Pop culture media and social media both problematically frame depressive disorders as something beautifully tragic, even leading some people to actually desire it. Clinical depression is often depicted in a specific manner, displaying people with symptoms of the disorder and suicidal ideations as obsessed with death and dressing in particular ways surrounding certain subcultures of people. People or characters with these traits are commonly seen as wanting their depression by dwelling on it, causing a problematic societal view on depressive disorders. So today, let's learn what really comprises clinical depression. Major depressive disorder, otherwise known as clinical depression, is a mood disorder that causes persistent feelings of numbness, sadness, hopelessness, and loss of interest in hobbies to the person suffering from it. At least 16 of American adults will suffer from a depressive episode at some point in their lifetime, but at what point is this considered to be a disorder? To be diagnosed with this disorder, the person must have at least 5 of the following symptoms: depressed mood, constant feeling of hopelessness, emptiness, or irritability, loss of interest, diminished interest in pleasurable activities, significant weight loss or gain, change of more than 5% body weight in a month without dieting, insomnia or hypersomnia, fatigue, excessive feeling of worthlessness or guilt, decreased concentration, or thoughts of death or suicide, recurrent suicidal ideation, and recurrent thoughts of death. To finalize a diagnosis, the patient also must fit the additional 4 points of required criteria: symptoms causing clinically significant distress or impairment in daily life, episodes not attributable to psychological effects of substances or other medical conditions, episodes not better explained by another schizoaffective disorder or psychotic disorder, and no history of manic or hypermanic episodes. There are many potential risk factors of major depressive disorder. Although these causes are quite common, someone who experiences any or all of them won't always develop MDD or have clinical depression manifested in some way. The 10 medically recognized factors are physical, sexual, or emotional abuse, age, elderly people have higher risks of developing depression, certain medications, significant death or loss, gender, women are twice as likely to develop major depressive disorder than men, genes, although there isn't one specific single gene that contributes to the risk, major events such as car crashes, divorces, and substance misuse. Although there isn't a single significant type of person who is prone to the disorder, large-scale brain studies have revealed that the brains of people with clinical depression have a smaller hippocampus than those whom have never experienced depression. Some researchers have found that the stress hormone, cortisol, is produced in excess in depressed people and believe that cortisol has a toxic or shrinking effect on the development of the hippocampus. There aren't many suggestions for preventing the onset of major depressive disorder, but you can help prevent the severity of your symptoms by doing things like getting enough sleep, eating well, exercising daily, and reaching out to your friends and family frequently so you know that you have a circle of mental support. There is active medication that you can take if prescribed, but large studies have shown that 2 out of 3 people on antidepressants still experience symptoms of depression. We've talked about major depressive disorder affecting ourselves, but what do we do if we suspect someone else has clinical depression? Although it is difficult to spot, if you are concerned for a friend of yours, there are a few characteristics to look out for. While battling depression, many go through a withdrawal from friends or family known as social isolation. They may ignore your attempts to reach out to them because they are too preoccupied with the negative thoughts they face on a day-to-day basis. I mentioned earlier in the video that loss of interest is also a symptom of clinical depression. The person you are concerned for may withdraw from their favorite activities and act apathetic towards them. Other warning signs are emotional outbursts and episodes. You may not be able to tell if your friend is getting sleep at night, but emotional outbursts of rage and sadness can be a telltale sign that their bodies are suffering from the emotional stress brought on by depression and an extreme lack of sleep. Someone suffering may also appear physically unkempt because they are too mentally fatigued to keep up with their appearance. The sadness and anxiety brought on by MDD can deter someone from showering, cleaning their homes, or doing other easy day-to-day tasks. However, this is not always the case with someone who is suffering from major depressive disorder, as somebody with the symptoms may physically appear as if there is nothing going on. Unfortunately, there is no guaranteed cure for clinical depression, and because of the lack of knowledge surrounding the topic, many people suffering from it will go undiagnosed. That being said, there are many medical treatments that have shown to dramatically decrease the severity of the symptoms the person may be experiencing. Things like antidepressant medication, therapies like cognitive behavioral therapy or interpersonal psychotherapy, and overall psychiatric help can help aid in curing and decreasing the severity of the symptoms of major depressive disorder. If clinical depression goes untreated, the results can be devastating, as the disorder alone is one of the main causes of suicide. Destructive behavior, such as drug or alcohol misuse, can become a huge risk when the onset of depression is ignored. Other self-harmful behaviors, especially in teens, are also a terrible and sometimes even deadly result if MDD is not treated early on. Studies done in American teens have shown that at least 20% of teens experience severe depression before adulthood, and only 30% are treated for it or even recognized, making these self-harm behaviors even more prevalent. A common myth about major depressive disorder, or just depression in general, is that the disorder is left up to the mindset of the person suffering from it. Although encouraging positive thought can be helpful, you shouldn't try to discourage someone from seeking treatment if you don't believe that they fit your standard of depressed. Comments like telling the person to just think positive or be thankful because others have it worse can seem helpful in the moment, but only further the feelings of blame and self-guilt in the future. There is lots of scientific evidence on why depression isn't controlled by the person alone, and that it biologically has a huge effect on the structure of the brain. When you are suffering from clinical depression, your amygdala, a part of your brain used for regulating emotion, can become overactive. When this happens, it is hard to stop, becoming the culprit for the sleep and behavior problems. Another part of the brain, your hippocampus, releases the hormone cortisol when you are stressed. When your brain gets flooded with cortisol for long periods of time, such as during a depressive or anxious episode, it can slow or stop the growth of new neurons in your hippocampus and overall affect memory and performance. People who suffer from depressive disorders don't just feel bad all the time, but rather have inherently neurological, biological, and chemical issues with their brains that they cannot instantaneously control. When seeking treatment for yourself or a friend, it is always important to remember that the healing process for depressive disorders is a complex and difficult process of discovering the right types of treatment that work for you. There are many ways to seek long-term treatment, but there are also many resources for urgent support as well, such as the National Suicide Lifeline, the National Depression Hotline, the Depression Crisis Text Line, and the Nationwide Teens Crisis Line. Today, we went over what comprises major depressive disorder, what to do if your friend is in danger, treatment, resources, and some of the scientific chemistry behind it. As always, thank you all so much for listening.